On the crows or here, I'm injecting, not because I'm concerned, I am concerned about these fine lines, but also because I want to produce a lift on the eyebrows. 3 points here. Okay, she doesn't need more than 3. Space starting at the lateral end of the eyebrow, space in a C shape, a space like 1 centimeter apart in a C shape, not going too down here. She has a little bit of malar edema. I don't want to aggravate that. And then the clue part, where it separates the good from the average injector, the forehead. Very low, raise your eyebrows. She has moderate wrinkles when she frowns, but not in resting position that much. And I'm injecting 3 points only. The lateral point I usually align with the highest peak of the eyebrow, and the center one, I just put it like in between these two. I want for a question to the audience, why do you think that I'm placing this marking higher in that frontalis? Yes, because this is the lower eyebrow. I want to get that lifted more. The most important aspect for me in this type of patient, even more important than the asymmetric brow position, is the lower face. When I met her yesterday, because she come across strong, when you start doing this, you inject only one close to the mandible angle, but when you get more experience, you can go up to the medial fibers of DAO. Okay, I'm injecting 2.5 units here and 1.25. She does a lot of frowning here at the mentalis. So I'm injecting, you saw Vic before, doing 2 injections on the side, which is perfectly fine. I like to inject on the center, and I'm doing only 2.5 units, okay? 2 to 4 units, mentalis, 4 units on each side. And in this patient, she does have an indication, and you will see, clench for me. These platysmal bands are completely aligned with the DAOs, so that's why I'm injecting also in the proximal bands of the platysma. I'm doing a little bit of this. I'm going to reshape this area so that she will have more balance, remove more weight from here, and put it here on the top of the heart shade. I'm going to do a little bit of the canine fossa here with Sculptra as well, and I'm going to do melolabials. This is her weaker side. So with the Sculptra, I might do a little bit more here on the left side than on the right side. She has a little bit of tear throw here. I already backstage put like 0.2 cc's of lidocaine with epinephrine here, underneath, like half cc's underneath of the orbital rim, because I'm going to place a 25 gauge needle later when I do the tear throw to inject Velotero with a cannula. I'm doing the Sculptra first here. If I do manage with the Sculptra in the mid-face cheek area to get things that I'm planning already get with the other fillers, I might be more conservative. And I'm going to go directly here to what we have described before, the deep medial fat pad almost. Okay. Is that okay, Kelly?
Perfect.
I'm gonna aspirate. I know that I'm below the infraorbital nerve here, and I will inject slowly, filling that area. I'm watching my scale on the needle. I'm injecting about now 1.5 cc's in a retrograde fashion. Okay, and now I like to move deep to the malar fibroconnective tissue here, and I think a safe way to do it, push here the skin and comfortably rest your needle in your non-dominant finger and go directly there to the bone. I mean maxilla, right there, malar prominence. Okay, I retrieve a little bit and I go up, and I'm gonna inject here, then this is like fanning because I'm not removing the needle from place. I'm protecting my orbit here. I'm on bond here, and I will inject underneath the malar prominence. This is a total of 2 cc's of Sculptra, previously diluted, in 7 cc's of bacteriostatics, and we place 2 cc's of lidocaine right before the injection. I like to make the projection a little bit more superiorly, something that you don't do in men. In men, you keep it like in a lower position. In women, I like to kind of go a little bit superiorly, deep, aspirating, and look here. And you see that I have built already this unit. I'm going to do the canine fossa here. I like to push up tissues and go there, aspirate, make sure that I don't get any blood there. And when I do here the canine fossa, which sometimes when I do the initial injection, I go a little bit perpendicular, but not deep to bone.
And we've been very fortunate. We've got the Cutera XLV set up, and the patients who appear to have any bruising are getting the 532 laser to improve bruising. I'll show some pictures of that in my workshop tomorrow. It works extremely well. We used it last year at the boot camp, and it really is a great tool to make people look better faster.
Here I like to paint soft tissue, and then underneath the muscle there, I go very deep, and I place like 0.2 cc's. And let me tell you that when I start injecting Sculptra, the only area in the face that I will get nodules was here. Okay, so I'm very conservative in terms. I need another side range.
I think because it's such a mobile area.
Yeah.
And if you stay right on the bone, under the muscle, and the muscle isn't moving it, I don't think that's going to happen. I think that we haven't seen that in a long, long time. The other thing, someone asked earlier, how are we making decisions on fillers? And I think all of the faculty is comfortable with all of the fillers, and it's a matter of a personal choice for whatever reason. But another factor is that we like to make sure that all of the fillers are represented so you can understand some of the nuances. And in a perfect world, a painter who's painting a painting certainly isn't going to use just one shade of green and one shade of blue. There's multiple shades. And what we're trying to do is really finesse all of these fillers to their maximum benefit so that you can start developing your protocol and your technique, because individually everyone's going to inject a little bit differently.
I think that when you're doing fillers, especially Sculptra or Radius or strong fillers, the medial aspect of the face, you tend to go deep. Those are the structures you're aiming. When you are trying to frame the face, like doing the lateral fat pad, then you go basically subcutaneous, the deep reticular dermis probably. And you see here that I went very deep here, almost to maxilla, here to canine fossa, here also to bone. Look, my injection diversion in terms of depth. Here, I'm going underneath the skin. But you see here, I'm not aspirating.
There's no bone there.
Exactly, exactly. And the nerve is deep there, okay? And something that you miss when you were talking is that I like also, I went here, underneath here to complete my jawline, and also in here, in front of the ear, I injected also here, okay? So that the continue of the line goes very natural.
As we age, the ear starts to fold and loses its youthful look, and the look lateral. If a woman hasn't had a facelift and you look at her ear, you can pretty much gauge her age unless she's had a little Sculptra anterior to her ear, and it'll take off 10 years.
I like to do a little bit of this Sculptra here, because I'm going to have the synergistic effect, I'm going to have a little bit of brow lift. And here, I'm injecting, I'm in bone, okay? Look here. I like to, of course, always protect my eye. Here, in this purple line here that I marked, is what I think on palpation is the border of the inferior orbital rim. Okay, I already put some lidocaine with epinephrine here. So, Kelly, tell me if this hurts.
Nope.
No? I'm gonna inject. I'm gonna leave that there. Okay?
Mm-hmm.
And then I have Velotero here with a 27 gauge cannula. The tricky part is that sometimes it's kind of hard to get the cannula through the skin and muscle. I like to pinch this strongly here. I retrieve a little bit and I move forward, forward. Forward here. And you know what? I'm injecting very little on the third row. She's kind of a good patient to inject because she has thick skin. Now, I'm doing a switch with the cannula. I want the needle of the product for this. For this amount of space, I don't want to place my cannula here up to here. I can just easily protect my anterior lateral orbit and inject directly here to bone, place like 0.1 or 0.15 cc's of Velotero there to fill this. Resting over bone, okay? Protecting my eye, moving back, and underneath muscle. Look here. Place a little bit of product, just a tiny bit. And then you can mold this here.
She was